Hi, welcome again to Laford Teletherapy Counselors Network as we discuss on breaking free from darkness, the power of medication. We will have different people on board to discuss, and we will take in your questions as we go. Private, you can send your private questions, inquiries, and compliments to Laford Teletherapy Counselors at gmail.com. And today, we are happy to have those people who are waiting to join us live. Thank you very much for always keeping time and keeping us alert because we don't take it for granted. I'm Velin Julie Obiero, and we have my fellow panelists here. So we'll take some time to know them. They will introduce themselves, and then we will see how the discussion leads to uh, the next things that we are supposed to discuss. So, Ivy, you can go ahead.
Hello, everyone. I'm super excited to be here as a panelist to discuss the role of medication in mental health recovery journey. So, my name is Ivy Nyaboke Nyagwoka. I am a third year student of psychology at Kenyatta University. I'm also a mental health advocate as well as a mental health content writer on LinkedIn. Yes, thank you so much.
Katimo, Doctor, you can give us a brief introduction.
Okay. Good evening. My name is Daniel Gatim. I'm a medical psychologist as director of Trust Mental Health Care, based in Kitale, and also we do physical therapy session, basically the entire mental health process in terms of psychiatric services, psychological services, based in Kitale. Currently, I'm in Kijabe Hospital doing some other projects, and I'm happy to be here today to talk about um, the role of medication in mental health recovery, which is a very good topic because there's a lot of myth that undergoes around medication, around psychotropic medication, around treatment of mental health, about psychotherapy. And today, hopefully, you're gonna uncover them, discuss them, and get to learn the truth concerning mental health. And basically, I'm a proud advocate about mental health because creating awareness, as my colleague has said, one of the important things that I look at each and every time.
Thank you,
That is a
Gatim.
good
Thank you
introduction.
very much. And I think we'll now go ahead and discuss maybe about our today's topic. And when you received the topic, how did you think about it? What did the topic drive you to maybe when you are researching about medication, when you are trying to find out about uh, how to go about the topic? What did the topic really intrigue in you? And what can you explain to us about our today's topic?
I'll go first. When I heard about the topic, what came to mind is what is medication. You know, when we are discussing this topic, the role of medication in mental health recovery, it's important for us to first know what the term medication means. And what I came up with is medication refers specifically to drugs prescribed to manage or alleviate symptoms of a condition. For example, if a patient is undergoing a depressive disorder and then they go to a specialist, the psychiatrist will prescribe them a medication which is an antidepressant. So yeah, that's my take.
Thank you, Ivy. I think that's a good thing. And for my case, I also went on the same line with you. I think what comes to my mind when we talk about psychotropic medication, the way you have defined medication is true, because basically we call medication that affects or treats any mental illness, normally call them psychotropic medication. And as you have said, the medication is a substance that interact with your mind to bring certain effect. Psychotropic, psycho means mind or brain, and tropic meaning an interaction kind of. So when I learned about the topic, basically I what came in my mind is type of medication that you normally use, their mechanism of action, the benefits of those medication, potential side effect, personalization of treatment, role of a holistic treatment based on what we know, stigma and misconception that comes in with medication, the long-term consideration of medication, patient empowerment at the same time, uh, uh, the resources and support that are needed for this patient to understand how to recover from any mental disorder. Yes.
Sorry, I think on my end was a bit disrupted, and yeah, it went to a dark screen and it's now back. So, Gatimo, you work as a clinical psychologist, and why do people really fail to understand why mental illnesses need medicine,
Okay.
and why most
Um,
people? Okay, I think that will be the next question. So you can just answer.
I can try to answer the first question that
Why?
you have asked about why many people. Uh,
Yeah, go ahead.
you can.
Why do people assume the role of medication when it comes to mental health issues?
Okay. I think one of the organ that is affected when somebody is mentally ill or somebody have mental health disorder is the brain, and brain is one of the complex organ that human being have. We know some part of brain, we know their function, but it's one of the things that basically most of us, even scientists, even professionals, we don't really have a lot, like we have yet to comprehend about our brain. And basically, such like people don't understand our brain can be affected as a crucial as that. At the same time, it's about us to create that awareness and make people understand brain, the way our organs can be damaged or affected. For instance, when our pancreas, this means they cannot provide diabetes. Depending on the age, diabetes type 1 or diabetes type 2. Basically, when our brain is affected, we can have certain kind of mental condition such as depression, anxiety. We can have psychosis, schizophrenia, and the types of spectrum of schizophrenia or psychosis. So basically, if people to understand how our brain can be affected, and it's important now to bring in medication, because now this is a biological condition. Normally, we take a mental illness as only maybe as a social uh, problem, as a mind problem, but not as a biological problem. Because if we realize or we have a recognition that mental health is a biological cause, is yes, as a psychological factor, is as a social factor, is as a genetic factor, but mostly is a biological factor also play a bigger role in in treatment of certain condition. Yes, yes. So basically, it's understanding of how We understand our brain and how our brain works and how our brain can be affected and how we can treat our brain when it is affected, just like any other medical condition that we normally have. Maybe I can give examples
So,
so that you can try to understand something.
okay, you can give us the examples.
Okay. Example for the case of mostly clinical depression. All as presented in one or the other, we have symptoms of depression. We have been sad. One time in our life, we have been hopeless. Sometimes you have been uh, having insomnia or hypersomnia. Typically, we can relate when somebody says they're depressed. But I normally say there is an aspect of borderline aspect of clinical depression, mood disturbance, or ups and downs of that you normally have. For the case of clinical depression, this now undergoes or it's over maybe psychological factors. That having depression or excessive financial help or support or assistance. But uh, the moment you get support or assistance, you're okay. You're no longer sad, you're no longer depressed or hopeless based on whatever you wanted. But the case of a depressed patient, a clinically depressed patient, this person might receive or might get the source of stress or the source of depression, those sad moods. But at the end, the mood does not change because this person lack dopamine, this person lacks serotonin, which is something that it is excited when we have uh, an increase in their activation or an increase in neurotransmitters such as them. That's the easiest way I can explain. It's like your neurotransmitter that help in communication in your brain are not there. So it can affect you in one or the other. That's why the role of medication helps to maintain or to make sure that there is a increase in dopamine level, increase in serotonin level, increase of neuro, not you can elevate the mood from sadness to uh, uh, mood stability. Maybe for that case, I can talk about the role or function of neurotransmitter a little bit. I don't know if it is it's prudent for our viewer, but it's something that you should understand. Basically, we have thousand around 100 and neurotransmitter, but there are around 7 work with, such as GABA. GABA is normally used in cognition and inhibition, such as serotonin that I've talked about. It helps in terms of mood. Epinephrine, it helps in terms of our motivation and vigilance. Sometimes also dopamine help in terms of reward system. When you have achieved something, if dopamine is released, then you cannot have pleasure or interest on whatever you have achieved. We have also acetylcholine, used in memory means. Normally, it's used in terms of sedation or sleep. It helps us in terms of sleep. So that's why there's some of antidepressants that we normally use them to help a patient sleep, such as mitazepine. It has it it or it help in it activate histamine to work in terms of receptors. And then we have glutamine. Glutamine is the main switch of a neurotransmitter. Call them excitation. What it causes, it excites the entire neurotransmitter. So sometimes, uh, as we continue with our discussion, we get to learn more uh, about them, and we'll discuss them kidogo kidogo so that all of us we can understand something concerning them.
So, I think you have done a lot of explaining. So, I'll just ask another question for Ivy. Uh, these sessions are more of educative sessions. Most of the time, I personally have come out and said that I learn more when we have these sessions because some things I might have learned, some things I might come across when working, but some things I learn on these forums because learning does not end. So I've always had so much to learn when we have these sessions, and it really opens my eyes, even when I have uh, counseling sessions with our clients. It challenges me a lot to maybe do more of this or do more of research because learning does not end. So Ivy, uh, I will just ask a question that I think you can give us the answer to it. So, uh, what what are some common misconceptions about medication for mental health? Which misconceptions have you come across about medication for mental health?
That's an interesting question. So I remember I was conversing with my fellow psychology student, and he was telling me that one of the misconceptions on medication on mental health is that the medication is addictive. And I was trying to explain to her and tell her that the medication is not that addictive if you are prescribed by a profession who tells you that you need to take this medication at this time and at this hour at specified dosages. And so that's why I think that's one of the misconceptions. And
Mhm,
another one I think is that many people think that medication is the only way to recover from mental illness.
mhm,
In that, if a person is undergoing a mental health challenge, they think that medication is the only way. To the contrary, medication is part of the recovery, in that you can incorporate other methods such as psychotherapy, the medication, to help the patient recover. Yeah.
Thank you for
Think that
the
medication is the only way.
sorry. Thank you for the good insights. And I think for to deal with depression, we always have different ways that have been used by uh, clinical psychologists, psychiatrists, and maybe counselors that work. So at times, people tend to talk and assume so many things because they have not yet been given the right information, or they don't know the right information. But once we do this more and once we encourage others to do it on their own platforms, and the other, I think also me, the other day I was talking to a counselor who was trying to raise something very important, that professionals are never out there talking about these things. Those who are not professionals are the ones who are always there giving advices and misleading advices to individuals or the public, because maybe the people with the knowledge think they have to be paid to give out the knowledge, which leads to uh, those who are not qualified enough to give the information out. So why don't we try most of the time to come up and give the knowledge freely so that we can create awareness and create a space in that anyone that needs the information can get it, and get it when they need it, how they need it, and whenever they need the information. So, Gatimo, during this period, as we were preparing for this, the last time we were talking about depression, I think we we did it 1 month ago. Someone came up with a question asking how. Let me just read it. Someone asked, how do medication work to elevate symptoms of depression? How do medication work to elevate symptoms of depression?
Okay. I love to use, so you bear with me, but I'll be as simple as possible. Basically, we use with much more of our antidepressant, we use monoamine hypothesis. Means there is three neurotransmitters that are basically elevation of our mood. Number one is the serotonin, number two neuroepinephrine, number three dopamine. Antidepressant work on those three neurotransmitter. You call them monoamine. Basically, it tries to retain those neurotransmitters. And I'll try to bring something. Our brain is billions of neurotransmitters. Neurotransmitters are something like cables that help us in terms of communication. Our brain communicates using those neurotransmitters. Nervous system. And neurotransmitter are chemicals that are released to pass information from one neuron to another. So basically, dopamine, when you are depressed, your dopamine level and your serotonin level, they are very low. And at the same time, your neuroepinephrine are very low. What happened with the antidepressant, it helped retain those neurotransmitter. When neuron want to communicate, there is a there's one neuron that sends information to another neuron. We call it presynaptic neuron, and information we call it synaptic neuron. So in between synaptic cleft, where now those neurotransmitters are released. So basically, when neurotransmitters shorter period of time are broken down, some of them attach themselves to their postsynaptic neuron, which they attach themselves to receptors. The other one are taken back to the presynaptic neuron, and others are broken down. So basically, most of our SSRIs and SNRIs, what they do, they prevent the partial breakdown of those neurotransmitters. Doing, they increase the amount of serotonin, dopamine, and neuroepinephrine in the synaptic cleft. By so doing, the increase of in numbers of neurotransmitters in the synaptic cleft help much more neurotransmitter to attach themselves to the receptors of postsynaptic cleft or postsynaptic neurotransmitters. So basically, they work on those three neurotransmitter, which are help us in terms of mood, in terms of reward, and in terms of just enjoying ourselves, basically, or in terms of motivation, in terms of getting feeling joy or happiness, and in terms of mood balancing. Most antidepressants, they take a longer period of time because they act on the surface of the neuron. So what we normally do, we encourage patients that antidepressant 2 to 4 weeks to take the effect. But the side effects are there, which I think by the course of time we're gonna talk about them. But this is what they do.
Mhm.
They act on the monoamine neurotransmitters, serotonin, dopamine, and neuroepinephrine. I wish I could have a drink so that I can show you. It's more easier like that.
Uh, Learning does not end. We'll just continue learning until we can figure it out and learn more and understand how to go about it. Ivy, I think the last time we had this session with Gatimu, we were talking about depression, symptoms, signs and symptoms of depression, and Gatimu, it was depression, signs and symptoms, and how to deal with depression. So, Ivy, there is a question that was asked the other time. We had so many questions and we couldn't deal with them all. And these are questions that were coming from people that have been watching the educative videos we've been doing. So, uh, someone asked, how does medication work in conjunction with therapy? Have you been in a space for practice, or you have been in a space to help others with the psychological knowledge that you have, or have you had a practice at a medical facility that does both medication and therapy? And how does medication work on in conjunction with therapy? How do they work together?
Okay, I've not been in the practical field yet. Since I'm a student, I'm a third year, and I think um, after I'm done with my third year is when I'll go for a practical study case, like the attachment or something. Well, for me, I think how medication can go in conjunction with treating depressive disorder is that medication alleviates the symptoms in that it reduces the how do I say it? The drug reduces the effect of the symptoms, hence enabling one focus more on their daily activities and become productive. Yeah.
Thank you, Ivy, for the information. And I see, Gatimu, you want to add something on that?
Yeah, I think what she has said is very good, very good, very good. Uh, Mostly with psychotropic medication, you combine them with psychotherapy, and the main reason why you give medication to the patient is to elevate the symptom, as she has said. Basically, is to stabilize the patient, which means medication provides stability, reduce severity of the symptom, and this help the patient in that um, to overcome whatever they are going on with, so that it cannot lead them to crisis situation of hospitalization. There are good psychotherapy that we normally also involve in the treatment of depression, which are basically CBT and IPT. CBT is cognitive behavior therapy, and IPT is interpersonal therapy. It really helps patient in terms of, for this case of CBT, it helps in identify automatic or adaptive behavior, or
Mhm.
kind of distorted belief that the patient has that lead them to have those depression. And with CBT, we help a patient learn strategies to modify this belief and practice adaptive ways and patterns that can help them in terms of elevating those mood, and in terms of viewing themselves as basically human being, or viewing themselves as they are. And now interpersonal therapy help a client identify the interpersonal relationship issues that may make them or may lead to those depressive symptoms. It can be as unresolved grief, be change of work, change of goals, heartbreaks. So interpersonal help us patient in terms of getting those factors that may influence that. But basically, medication is just to alleviate the symptoms and stabilize the patient.
I think the last time we had this discussion, we were trying to talk about and give more information about depression. And what stood out for me is that several people wanted to really know if long-term implication of using medication, and what are the long-term implications of using medication for depression. And some were even asking which types of drug they can use which we specifically said they don't have to do over the counter. They have to seek professional help and get the guidance on how to go about it. So uh, I will, Gatimo, I think this is for you.
Okay. Yeah.
Huh.
Basically, I think the other time we talked about antidepressant that we normally use. Mostly we use SSRIs and NRIs. We have other categories. We normally call them uh, atypical antidepressants such as bupropion and metazapine. They are very good, but we give them they are safer. But the other categories such as we call them TCA, tricyclic antidepressant MOIs, monoamine oxidase inhibitors. We normally don't use them uh, basically as the first line of depression and as the first line of treatment of depression. Normally we use SSRIs and SNRIs, which are mostly they are safer drugs than gentle drugs in terms of their side effects. So basically with SSRIs or basically most of the antidepressants, we give them in a minimum of 6 months to 1 year. That is
Mhm.
how patients take medication, a minimum year. And basically they are not given over the counter. If you want to go and buy antidepressant for those who follow protocol or those who are very professional, they are not gonna sell it to you because you need to
Mhm.
have a psychiatric prescription from a doctor, from a psychiatrist, after you have discussed the benefit and their side effect. Because most of the antidepressant or most of the psychotropic medication, they have their side. To know them, we need to manage them. We need to understand the effectiveness. At what period are they gonna be efficient or effective in terms of their alleviating those symptoms. So it
Mhm.
goes a lot of things that you need to understand because also some of them they have uh, food interaction or drug interaction. That is something to discuss about. But most of the SSRIs and NSRI are safer medications, so they don't have a lot of food interaction or drug interaction.
Mhm.
So it's something to be careful. You shouldn't go and buy antidepressant over the counter or any other psychotropic medication over the counter. Just discuss with the psychiatrist, learn their benefit, learn and know how to elevate or masquerade through any side effect that you might have. Because as I said earlier, with antidepressant, the side effect first before their effect. And the effect you can see their side effect even after a day or two, but the effectiveness will
Mhm.
happen after 2 weeks to in a range of 2 weeks to 4 weeks. Yes.
That's a long time. That's a long
Yeah,
time to
that's why.
wait.
Yeah. So basically, when somebody presents themselves with uh, some symptoms that are and we call augmentation. You augment the medication with anxiolytics. If you have MDD, major depressive disorder, with some anxiety features.
Mhm.
So basically, what they will do, they will give you an anxiolytic for 14 days because most of the anxiolytics are very addictive, and then with the same antidepressant, so that after 2 weeks, the antidepressant will have taken the effect. Mostly, serotonin take about 2 weeks to take effect. So by the end of the 2 weeks, you can only use serotonin as you move on.
Mhm. Thank you, Gatimo. And now, Ivy, huh, I have a question that I want you to answer for me. What led you to advocate for mental health? That's one. And can you share a close experience or personal experience with depression? A close experience, that means like a relative, a friend that has gone through depression and how you see them deal with it and overcome it, or how did they end up. And the second, that was the second question. So the first question was, uh, what led you into a mental health advocacy? And then you can tell me to read for you the second question after you have answered the first one. So the first question is, what led you into mental health advocacy?
So the reason as to why I chose to advocate for mental health is because I study psychology, and the knowledge that I gain from psychology, I want to use it to teach others to know how to come up with coping mechanisms when they're faced with depression. And also, I chose to advocate for mental health because I grew up seeing people around me undergoing depression and using coping mechanisms that were not healthy, like consuming alcohol so that they can deal with their stress instead of using healthy ways of dealing with their stresses, like going for therapy or journaling or engaging in hobbies or talking to a trusted friend and such stuff. Read for me the second question, kindly.
The second question,
Mm-hmm.
uh, can you share a close experience or personal experience with depression?
Well, for me, I don't think I've ever undergone depression, but I've seen my friend undergo depression, and by that time, I didn't know what depression really was, so I wasn't able to help them. But now that I started to advocate for mental health, I think I'm able to like help someone when they come to me and talk to me and tell me that they're going through one, two, or three things that are disturbing them. I think for now I'll be able to help them. Yeah.
Thank you, Ivy. And Gatimo, uh, did I ask it or do I ask it today? What led you into a space that you advocate for mental health?
I think that's a good question for me because mostly I came to realize it, the importance of mental health advocacy when I was practicing it. When I was
Mhm,
practicing, mostly when I was in school, when I was taken, because I started rotating uh, the hospital in Terech when I was in second year. So I came to
mhm,
realize most of the people, including patients themselves, they don't understand what they are going through in their lives. Some of them are undergoing depression, some of them are undergoing bipolar. And when, especially bipolar 2, for example, especially when a patient comes to the hospital, and some of them have been misdiagnosed because they presented themselves with major depressive disorder symptoms and without mania or manic episode is not there. So they are either having hypomanic episodes which are not closely be seen in somebody. So uh, helping people understand what they are going through even before they reach out to any professional is very important. For them, they can present their symptoms easily, can help them because sometimes you are more likely to recognize some of the mental disease because they are more like they have the way I said about bipolar and bipolar 2 very close. You can end up diagnosing a patient with depression and they have bipolar 2 and when you give them antidepressant, they are more likely to come next time with manic episode. So basically, for me, I just wanted community to know because some of the family they bring the patient in their hospital. Um, they are like
mhm,
we, I also undergone depression, but today I'm here. They don't understand why the patient has the same symptom or is feeling or she's feeling the way she's feeling, rather than they have
mhm,
undergone almost the same process or situation, but they don't know why the patient is like that. You can have a brother or sister coming to to for psychotherapy or something, or for mental services. And
Mm-hmm.
our brother has overcome, but maybe the sister have yet to overcome. Is the point? So they are more likely not to understand. We have undergone the same situation. Why are you not like me? You changed. Why are
Mm-hmm.
you depressed? You get the point. But at the
Mm-hmm.
point of educating or psychoeducating the family to understand the reason this patient is feeling the way they are feeling, it's very important for them to support them, for them to embrace a treatment, and by doing so, you're killing. So basically, I create or I love creating mental health awareness, just that space, or to bring in that information and help our patient understand more about mental disorder so that they can support a family member, a friend, or any other person that they may find in their way.
Uh, I'll just share the same question. Can you share a close or personal experience with depression? Have you been depressed before? Can you share a close or personal experience with depression? Gatimo.
Okay, that's for me. Okay. As I said earlier, all of us we have ups and downs of life, and
Mm-hmm.
basically, I didn't reach to a point of clinical depression, but I have felt sadness. I have felt sometimes hopeless based on whatever has happened or situation. Uh,
Gatimo, you're frozen. As we wait for him to come back, uh, recently we handed a report of a research that we were carrying out on mental health issues, basically for clinical officers or people that work in hospitals, uh, people that work in different spaces that they deal with different uh, people with the mental health issues, depression, mental health disorders. And one thing that we noted as we were submitting the research is that even nurses, doctors, and clinical officers, basically the people in the medical practitioner, do have episodes of depression, do have episodes of dealing with mental health issues. One notable thing was that most of the time when we work with people with difficulties or people that are in different spaces that they are not, they're in bad situations, you tend to feel for them, and you might easily be in a situation that it overwhelms you and you find yourself maybe with a different episode of depression or mental health issue. And at times they have burnout through working with different people and working for long hours with these people. At times they also feel a bit low because this these patients at times, some become worse or some even pass, some even lose their life along the way. So, men- sorry, mental health is something that cuts across, and at times we fail to know which degrees or which level are the mental health issues are, or the level of depression. But generally, almost everyone, uh, in different circumstances and in different seasons, face mental health issues. So I think we are more, we have more, uh, we are trying to create more awareness because even at workplace you can face mental issues, at school uh, at home, maybe dealing with people with addiction, you still can face mental health issues. I think Gatimo is back, and welcome back. We lost you for a bit. It's technology, so we really understand. At times, it happens.
I think people are calling me back.
Where were we? What were we? Uh, where were we?
I was trying to explain about my encounter with depression. Did you get anything?
Yeah, yeah,
Uh,
yeah.
I
You
think
said
basically, yes,
always have their episodes.
yes, but I'm yet to reach to a point of maybe clinical depression because there's those levels in terms of assessment. But basically, I've had
Mhm.
problem maybe in my career, problem in my work, maybe some family issues, and you have those symptoms up and down. And but basically, it's something that I've tried to manage them based on self care, resilience, support from family member and friends. That is something that is very important. Yes, yes.
So when you went off a bit, I was just giving an explanation. Recently, we handed in a report for some research we were doing, and it was a report that was dealing with healthcare workers. Basically, one of the findings of this report was that uh, several healthcare workers always face mental health issues from dealing with the terminally ill patients, from dealing with mentally retarded or mentally people with mental health issues, and from burnout, from just dealing with uh, different things that are in there are in the facilities. And one thing that uh, another finding was that mental health issues are cuts across. It does not matter wherever you work, as long as you work, as long as you do something that you do every day, as long as you go to school, as long as you work in a bank, you work in a private sector, you work in a mental health uh, what are they called, hospitals, the facilities, medical facilities, and also children. uh, a certain amount of children have mental issues, and this really struck me a lot because we always assume, and most people really don't take mental health that seriously until it gets to a stage that now it's out of hand, is when we start working on it. And this was very visible even in children, even in teenagers, children as low as the ones that are starting school. Yeah, because it's a new thing in life, it's something new to them, and a bit of stress can bring mental health issues. So yeah, that was what I was sharing before you came back. And the other thing that came up when we were discussing about mental health, and someone asked, how did medication help you? Oh, that was different. uh, yeah, the next question someone brought in was, can improving your quality of life change your mental health state? I think we discussed that when we had another session with Judy Akita from Uganda. And there is where you are advising people not to have unrealistic goals. Can you remember when you were saying that if you have money to buy a Vitz, you can't have a budget of a Range Rover? So another question
I do
was,
remember about that. Mhm.
what advice will you give to someone who is considering medication for depression? What advice will you give someone who is considering medication for depression? Ivy, can you
I
go
think
for
that
that?
okay.
Let Ivy go for it and then you can maybe put more insight to it.
Okay, I think there are factors to consider for mental health recovery. And number one is the severity of the symptoms. In that, medication is often considered when symptoms are severe enough to significantly impact the daily functions of an individual. If an individual is not able to go to work, is isolating so much, and is not able to focus on their daily activities, it is important for them to consider medication. And number two is the patient's preference. When a healthcare provider or a psychiatrist is considering on prescribing a certain medication to a patient, they should consider the patient's preference. In that case, the mental health professional psychiatrist should give details to the patient and explain to them the side effects, when to take the dosage, and yeah, that's what I think. And also the diagnosis, a clear diagnosis by a qualified mental health professional is crucial. Conditions like major depressive disorder, bipolar disorder, schizophrenia, and severe anxiety disorder often benefit from medication as part of the treatment. Yeah, that's what I think.
Thank you, Ivy. Thank you very much for the insights. Getimu, do you have something to add on it?
Yes, thank you so much, Ivy, for that. I think something that I can add is there when you're looking forward to for psychotropic medication. It's not a quick fix, as I said earlier. Medication just help you elevate the symptom, but there's other factors of the other things that you have to do in terms of a lifestyle change, support system, and self care. That is something that are very important that I can insist about. Most of us we go for medication because we want a quick fix, but medication is not about quick fixing. It's about your adherence to those medication and adherence also to psychotherapy, self care, and support system and life changing. It's very important for you to know that. Yes.
Uh, I think we're getting somewhere, and we're getting into uh, the second hour. So another question was, and this I think was asked like twice or thrice. How can you help or support a friend or a family member who is taking medication for mental health? And the other question that was all related to that was, how can you support a loved one who is taking uh, therapy or mental health services? So I thought they related a bit, and maybe it was just a question about how do you give support to, how do you become a support system, something of that sort. How do you make sure you are the right support system to a loved one that is trying to take mental health services? Ivy, can you go for that?
Yeah, I think
How do you make sure you
how
are the right support system for a friend or family member?
I think how you can support a loved one who is taking medication for mental health issues is that you encourage them,
Mhm.
in that tell them to take their medication as prescribed by the psychiatrist at the right time, at the right with the right dosage, and also encourage them to use to go for therapy as well. You know, you cannot be taking medication alone, as Dr. Gatimo had said. Medication goes hand in hand with psychotherapy. And so by encouraging them to take the medication and to go for therapy is important. Yeah, that's how you can support them.
Getimo, how do you make sure you're the right support system?
I think what Ivy has said is very important and very good. Maybe what I can add is to help the patient and identify triggers, which is very important for in case of a patient who have panic disorder, a patient who have bipolars, even MDT. When you help them in terms of identifying triggers and managing them is very easy for
Mhm.
for effectiveness of medication, and at the same time be as yourself, because this person doesn't want a lot of sympathy also. I think that you're gonna treat him or her in a different way, but at the same time show them that they are still people, and they're still your friend, they're still your brother, they're still your parent or your family member. Be
Mhm.
just as you are, as a human being, as a person. It's very important for that, and show them that they're no longer different in any kind. At the same time, give them the true information concerning whatever they are going through. Let them understand that you love them and you care for them, especially for the sake of depression. Some of them, they feel they are responsible of their symptoms, or whatever they are feeling is not all because of them. Let them know that they're okay in your hands, and you still love them or you still care for them.
Sorry, we have lost Evie. I think she'll be back in a short while. And another thing that I've really come up in different ways is, uh, you know, yesterday we were discussing on different things about, I think just someone sent in a question about suicide, and yeah, how they attempted suicide and how do they make sure they don't do that again. And it can relate to a situation of someone who has gotten has been involved in a fatal accident, and now they have to survive with the new normal, or they were not crippled before, now they are crippled. They even lost a leg, now they have to use different improve gadgets to help them live their normal life. In certain situations that we personally don't know how to handle, maybe as a caregiver or as a support system, how do we make sure we do it rightly without maybe making them feel like burden, or uh, feeling like we are over sympathizing with their situation?
I think let me start from this point where if you have a family member or a friend who has a plan to maybe commit suicide or something, that's for psychiatric, we call them is a psychiatric emergency, where they need to be admitted for that case. In terms of support, especially for a patient who have already attempted suicide, and the patient has healed and going on with her life or his life, it's very important for us to continue supporting them in terms of educate them uh, about the importance of just sharing the problem of seeking professional help when they have issues. Uh, but at the same time, let them participate in social activities because it depends of how other people view them and view themselves. But the most support you can give that patient is where most of us we don't understand or we don't know how we can help our family member or our friends. But one of the main things you can do just lead them to a professional where they can get a professional help. They can be assisted in terms of uh, cognition restructuring because most of them they have distortion about their future life about themselves. They can have, especially for a person who have undergone maybe traumatic experience such as an accident, have lost their leg, maybe the deformation or something. This person will have a different perception about themselves. Uh, and
Mhm.
one of the key things you can do for them is just to refer them for a professional where they can be helped in terms of thought structuring and help them in terms of imaging and how they can know themselves because there's we call it body dysmorphic where person view themselves in a different perspective depending on the weight gain, depending on their body mark, depending on the color, and these are they are mental health conditions. They need a professional to help them in terms of treatment and in terms of management. But for that case, I prefer first let them seek for professional help. Any person who have attempted suicide or any person who have a suicidal plan, please refer them to psychiatrist or psychology where they can get further help. Especially for a person who
Mhm.
have a suicidal plan, please, that is a psychiatric emergency. Even when they come to hospital, we admit them because can be dangerous to themselves. At the same time, they can be
Mhm.
dangerous to other people. Yes, yes.
Welcome back, Ivy. There is a question we discussed yesterday in yesterday's forum, and as you know, we had planned to do this for the next for 4 days, Monday to Thursday, and someone brought an issue of being suicidal, and I think we did answer it yesterday. We have raised it again today because basically, in the past few, like the past 1 year, it's evident that so many people have been trying to take their lives or unalive themselves, and so many people are becoming more suicidal. And someone wrote the question through the private, someone DM'd privately asking if you have attempted suicide before, how do you make sure you don't do it, try again? And then the other part of the question that we plugged in was, uh, how do someone in that state, or even someone that has had a fatal accident, deal with their new normal? Because in any case you are involved in a fatal accident, that means you might have lost your leg, any part of your body, or maybe your spinal cord is injured, so you have to use a wheelchair or something, and maybe you have some deformations, which still you need some professional help and some encouragement from a support system. And how do we make sure your support system does not overdo or does not over sympathize? So we can look at, I think, the last question, and I think someone also, yeah, I remember one question that was asked, and I've always seen so many people asking it in the private messages. Uh, something related to support system. So many people have always raised concerns because there's a session we talked about if you can always go for therapy because you when you are a support system you can feel you need therapy because whatever you are dealing with it surpasses what you can deal with, or whatever you are dealing with you feel it's a bit heavy on your end, so you go for counseling on behalf of maybe uh, a family or a friend who is addicted, a family or a friend who is going through terminal illness, and or maybe when you are a caregiver and you are giving you are offering the services of a caregiver, they tend to have burnout, and at times they go for uh, therapy just to deal with the current situation. And something that it has come up in different sessions that we always have, and so many people have raised it up because basically when you are handling a cancer patient and you tend to walk with them the journey, you tend to have different episodes and different lapses in emotions. So do you advocate for a support system or a person who is offering support system to go for therapy? Ivy, do you advocate for someone who is a support system to go for therapy? Basically, a support
Yeah,
system is go ahead.
absolutely, absolutely. I advocate for that. They
Mhm,
can go for therapy, or they can opt for joining support group. Joining
mhm,
support groups is so important in that you find people who have um, common interests and the common situation. And when you are discussing, you don't feel judged. You feel that every person there listens to you, and after maybe the session, you'll feel better. I think joining a support group or going for therapy is okay for those who offer therapy to others. Yeah.
getting on now that that's our last question. I think our last shared question. What do you think about someone who is a support system going for therapy?
I think that is true. I normally also do here, in that
Mhm,
when I'm not okay, I don't feel okay, I talk to another psychologist or psychiatrist. They can help
mhm,
with psychologist, so that you can help each other in terms of management. Basically, it's okay to seek a professional even if you're a professional. Because number one, if I have malaria today, where will I go? I'll go
hospital.
for another profession to help me.
Mhm,
What basically happens, medical practitioner doesn't mean you get sick or something. You also need help or
mhm,
support in one or the other. But basically, you can look for a family member whom you can reach out, and who understands you and can support you. Your friends also, they can support you. Your colleague also can support you. Support group also can support you. At the same time, a professional also can help you in terms of your own personal issue, personal matters. We all need one another. At the same time, we all need profession to help us in certain areas of work.
mhm. Yeah, it has even reminded me as the group of counselors that we have always advocated whenever you have an inlet, and like you let people talk to you about their issues, you have to have an outlet. You can't carry everything that you have been told alone. So you also have to pour them out. And then the other person has it's a something like infinity. It continues. Whenever you have had several sessions a week, you still have to take time and seek for counseling. Because if you don't, one of our lecturers back then used to say he found he found himself into a situation that led to his divorce. He died during COVID. He always said that whenever he could have couples counseling, every couple could come with their issues. And in Kiswahili, we always say, amenifanyia nikamfanyia kanifanyia. So you will go back home and look at the wife and wonder, what is this woman secretly planning for me? And one day, when he had had those feelings for a very long time, he just decided to divorce the wife. Not because the wife was bad, but because of the couples counseling sessions he had. No one was always positive about marriage. No one. It's the same way. Like we go to internet and we just the much we consume of the much negativity we consume on a daily basis, and the much that people write and talk about in the socials is just hectic. So at times we need a channel to pour them out. And if we overthink about whatever we see on the socials, it also affects us. It also affects our relationships. Like something that has always triggered me, the CCTV bulbs that people are always putting at home and then they see their children being beaten. This thing has really triggered me a lot. And when when I always see those videos, at times I don't even want to see them because it will make me think I need the CCTV bulb when I'm not away to look what is happening at home. But it will also distract my work because most of the time I will be focused on what's happening at home. What is she doing? What is he doing in that space? So I think the much negativity that we hear or listen to really needs to be channeled out. But what if we don't channel that out? It's the same situation with someone who is a caregiver taking care of a terminal ill patient. The suffering that those people undergo really affects them emotionally, physically, and everything. But what if they don't go for counseling? They can even die before the patient. And that happens a lot. They are not the
Do you feel he has a network problem, or do I have a network problem?
I think he's experiencing oh, he's back.
sorry,
Or she's back?
sorry. We have a power shortage. We have a blackout. So yeah, we can. Ivy, you are talking. Just go ahead, kindly.
I was just saying you are back. Yeah.
Ivy, you can give the shout outs. You can give us maybe those you who have mentored you, those you want to say hi to, and then yeah.
I'm giving a shout out to my mentor, Bella Benitayo. She's the one who actually inspired me to start writing about mental health and to create a LinkedIn account. I'm so grateful to her and my parents as well. Obviously, they've been so supportive. I also thank um, Lafford organization for this opportunity. I've actually learned a lot from both of you professionals. I'm still learning. I've not started practicing, but through today's discussion, I've learned a lot. And I just can't wait to be a psychologist. Yeah, thank you so much.
Thank you so much, and we are happy to be part of you. We are happy to work with you, and education is not limited. I can learn from you more than I can think I know, or you can learn from me. It does not have any direction. We learn every day, and we learn from different people, even the people we don't expect to learn from. And I was very grateful you had so much knowledge, and it shows a lot about how where you are going or wherever you want to reach with your goals and everything. And I'm so much happy for you and excited, and everything will turn out the way you expect it. Wherever you put the goalpost, you'll reach wherever you want to go. It's always a pleasure to meet someone who is working on their goals and focus to reach it.
Yeah, thank you.
Welcome. Gatimu, you can give us the shout outs. We have a new one.
Okay. I think before I give my shout out, there's something you said about suicide, and I wanted us to know something small concerning it. If you have a friend who is talking about dying, about committing suicide, most probably we not only focus on suicidal plan alone or suicidal ideation, but also we focus on the factor that are causing him or her to think about that. Sometimes they might have another mental health disorder. Sometimes they might having an issue to talk about. That's why I brought in a significant interpersonal or stroke relationship issue that are there. Basically, they need to be taken to a professional where we can identify the main cause of this. Because even suicidal is a symptom that has a certain cause. Sometimes they might have a depression that and suicidal thought is one of the symptoms. You get the point? Some of them might have PTSD and suicidal thought are some of their symptoms. At the same time, some of them might be experiencing psychosis. So it's very important for you to bring them to are professional so that it can be assessed and they can be helped. My
Mhm.
shout out will go to number one. Let me give my shout outs here to you guys first because it's been a nice experience today. I'll, also, I've learned a lot, and thank you, Ivy. You're gonna be one of the good mental health practitioner in this country and even beyond. That's a good thing that you're doing also there. And we I normally love sharing, and one of the fine things that I've had this opportunity that I always get to share in this platform, and that is a good thing. And today my shout out goes to people whom I work with in Kijabe. They are one of the best people that I work with. Support system. Normally, when we have seen a patient daily, like today, we before I joined in, we had a small debriefing, and I know tomorrow morning we normally start with debriefing to share our experiences, our situation with the patient, and that is one of the ways that they help us in terms of well-being, individual well-being, support group in terms of in your workplace with your colleagues. So basically, my colleagues is one of the best support group that I have because of debriefing sessions that we normally have.
Mhm.
That's something that I always acknowledge and I always love. Yes, yes, yes. And to you guys, you are doing a good job. Lynn, you're doing a good job.
Thank you very much, Daniel. And one thing I've always liked about the current facility you are in, it's that I can remember a bit of what I learned when I visited there some time ago. I think it was 2013. The morning devotions. Something I've learned along the way as we do counseling and maybe therapy is that at times mental issues or mental health issues are more spiritual. Like being sick can also be very spiritual. And at times, the morning devotions at his current facility, even when a patient is being taken for operation, they pray as the doctors and they pray together with the patients and the patient's family. And on a Wednesday morning, they always have, I think, morning devotions where they pray, they share what has been happening during the week and during something of that sort. I think that's what I remember when I was once maybe there for some days, and it really intrigued me, and I learned a lot from that. And their facilities alcohol free. So is it alcohol free or how do we call it? It's substance abuse free,
What
something
we
of
meant,
that sort.
yeah.
Pardon?
Basically what you have said, we give a
Mm-hmm.
holistic care of our patient because we are always, we are physical being, we are psychological being, we are spiritual being, we are social being. So holistic aspect of health, that is normally what we do here,
Yeah.
and that is very good.
Holistic holistic health. Yeah, it really intrigued me a lot. And my shout out is always to everyone who listens, everyone who needs mental health aid, everyone who offers the mental health aid, because with the aids that we get, with the education that is done, you create more awareness and we get to save a lot of people without knowing them, without reaching us on our personal spaces, without giving one-on-one time, but there's still some impact that is created. And most of the time we get more questions to answer and we get more inquiries from people even we don't expect, because LinkedIn, personally, today I've remembered to do this. We have really had free services from different platforms like Restream, it's always a free package. LinkedIn, that we also do the they offer the live stream, it's still a free service. YouTube is a free platform that we give information out and they spread it to others. So this softwares or these apps have really helped us to get to more people. They are more like partners because they've really helped us reach so many different people. Google, Gmail, Google Form, and also Mom's Cover. Panat's technology has really helped at this time round. Lights Affordable came in. LaFord, it's still one of the organizations that has really helped us during this season. And those are my shout outs for today, for myself also, and for the knowledge you people have always offered to offer. It warms my heart when I can see people have decided to sit to give information about different things and specifically mental health issues, which means even without going out with a microphone, you have saved more lives, you have saved more families, and that will be remembered for decades. It will it will live past you, it will really impact different people. And one thing with these platforms, it's not for today alone. This information are always spread out in different ways. And so many people reach out the information because there's a clip we did and the turnout was not large. but right now it has reached more than, I think, 100 people, which means even if we do it today and it takes longer to spread, but those people, even in 2020, in 2030, they will still come and use the information, which means we are doing something that is beyond us. So I'm very grateful for always having these sessions, and I'm grateful for you people coming on board just to share. And I'm very positive about this because I've seen the impact, and I've seen so many people always asking about different things they're dealing with. And the much we can do, we have always done. The much we can't do now, we'll do in future, or someone else will do. So kindly always have the courage to even go on LinkedIn just to talk about anything. You can organize a audio event just for people to come and listen. You can organize a visual event. Anyone will just come in, and that creates more impact than you can think. Returning back to the earlier thing I said, that professionals don't go out there to give the information. It leaves the unprofessional to give any type of help they can. So you are qualified enough to go out there to give the information, and we can always share them on this platform. These platforms, we have different platforms. We have Rumble, we have Instagram, we have LinkedIn, we have YouTube. So you can just share the posters. We can always post them on any of the platforms just to make sure someone comes in and listen and solves a situation. So till tomorrow, because this week we have tomorrow and Thursday to the end of it. And then the month of November, we'll be having a free mental health we will be offering mental health services for free counseling. And yeah, we are welcoming anyone who needs the type of help and type of counseling that we'll be having on board. So Ivy, thank you very much. I'm always excited about everything. Thank you, Gatimo, and see you next time.